to this third session. Today we have with us a distinguished speaker, Dr. Saravanakumar-AI. I am very happy to introduce about him. He obtained his PhD in Medical Science and Technology from IIT Kharagpur. After his PhD, he worked as a senior lecturer cum research fellow with University of Technology, Malaysia, before moving to UK. He is presently affiliated with the University of Lincoln, Department of Biomedical Engineering, UK. He is experienced in manufacturing nanomaterials with electrospinning and characterization using scanning electron microscopy, atomic force microscopy, X-ray diffractometer, thermal and mechanical and wettability analysis. He is also expert in vitro techniques for cytotoxicity, biocompatibility, and hemocompatibility analysis. I'm very happy to invite you, sir. So over to you, sir, please.
Okay. Thank you. I don't know who had given this introduction to about myself. Thank you very much for this. But I think all the speakers would have realized me that why I am here, because you could see that when the speaker introduced me, he never used single word in relation to AI. So please, okay, I am not an expert in this field. I'm also like a learner in this field because I'm a material scientist, but currently I'm also indulging myself in AI. So this is one of the work that we did in collaboration with my collaborator. He's I think from Sastra. Dr. Adalars is also here, I believe. So that's it. I think fact is that in AI you don't need to be an expert. As long as you find a good collaborator, you can survive in this field. Okay. So with that brief introduction, today what we are going to see is that how the machine learning can be used to predict the blood compatibility. So another what is say big confusion that seen in the topic. Okay, I apologize for that because there has been big confusion going on which topic to speak. Finally, I concluded with this topic. So the topic that have been shared with you may not be similar with it, but I think that you will learn something related to the AI and materials as well as some sort of medical devices field. Okay, so these are the things that I'm aiming to touch with this presentation. So first, as usual, okay, I always use this publicity stunt. Please bear with me. Okay, so this is about University of Lincoln. This is a university where I work for. Currently, I'm working as a senior lecturer with this university. It's a nice place to live and learn. Okay, it's not high ranking as other universities available in UK, but relatively, I think it is ranging. It's range around top 1000 to 1200 ranking. And also you could see that it is blessed with nature. Okay, so if you love nature, okay, and then if you are into engineering field, okay, so University of Lincoln would be an ideal choice. Okay, so please feel free to ask me if you have anything, that if you are keen on pursuing a PhD or a master's. Okay, University of Lincoln would be a good option for you to examine. So after that publicity stunt, this is about myself. Okay, so what I do currently is that I'm developing biomimetic materials for medical devices and tissue engineering scaffolds. So I'm not going to deep into introduce myself about these facts. Okay, so one thing I want to repeatedly highlight is that what I do is that I'm trying to manufacture materials that mimic cells natural environment, so that medical device that I am developing is not rejected by the our body, because whatever material we place inside the body, okay, our immune system consider it as a foreign thing and then try to reject that implant. So to avoid this, I'm trying to develop some biomimetic materials that can be used for medical devices.
Sir, good evening, sir. Sorry for interrupt. I
Yes,
think the
please.
slide is not okay.
Visible.
No. You are in the first slide or which slide, sir?
I
Yeah.
am.
It's not. Now it's okay.
Okay, okay, okay. I will maintain in the same position.
Right, right.
Okay,
Please
okay.
put it in the full screen mode, sir.
Full
Yeah,
screen
that's
mode.
why I think I put it in the full screen mode. But you were saying that it's not visible. Can you think because it's not moving? It seems when I put a full screen mode.
Okay, now it's moving.
Now it's okay.
No, I just moved it voluntarily. Is it fine now?
Yes, sir. Yes, sir.
This is fine now. Okay,
I think. Yes.
okay, okay, okay. No worries there. So that's about my introduction about my research, what I am doing. The next slide, okay, talks about my publication. So you could see that I published nearly 183 papers, and then my H index is roughly around 50. And constantly, I think I publish most of the time in collaboration as well as in an individual manner. So collaboration is a key way to do more publication, and these are my publication metrics as shown in this slide. So what I want to highlight is that whatever research we do, okay, so it should be what you say referenced, or otherwise it should be used to the scientific community. So in order to evaluate this, I would equate this to my H index. Since my H index is around 50, it shows that my research is widely accepted by fellow scientists, and then it is also somewhat relevant to the international quality. So that's the purpose of this slide. So coming to the today's talk, what I'm going to do is that I'm going to briefly introduce you to AI. I know that you people are much aware about AI compared to me, but in a very brief manner, I will try to introduce the AI, and then I will introduce you to my field, that is medical devices as well as electrospinning. So I will try to introduce how this electrospinning is used to fabricate the medical device, and then I will slightly introduce a little bit about blood compatibility, and then I will slowly give you some sort of dosage. Okay, it's not going to be a perfect comprehensive work. Okay, some sort of a work that I had done. Okay, in order to show us how this machine learning can be used to predict the blood compatibility, and then final slide summarizing what's the finding of that work. So about AI, okay. Before going into the in a definition of AI, I just felt that I should introduce something very common to every one of us. Okay, because as a human being, we always what you say keep ourselves motivated in order to see what is our future. Okay, so you could see that the word to see the future, okay, we need to get some prediction. Okay, so this prediction is based upon some sort of facts. Okay, so this is one quick example from our cultural background. So you get based upon the age, based upon your birth time. Okay, we have been fixed with some sort of astrological signs. Okay, and then this science could be used to predict the future. So it's some sort of inspiration where the AI is coming out. Okay, and then this slide shows that how sort of different modes of mission, some sort of ways that we learn to predict the future by using various tools. Say, for example, you can use Parrot or otherwise even some scriptures, and also now advanced way to predict future is using computers. Okay, so what I want to highlight here from this slide is that so the spirit for understanding or otherwise to know the future is always exists within us. Okay, so this thing I believe that this it's not something like that. There is no link. I don't want to put anything people from who are already a machine learning expert and then talking about what sort of inspiration. This is my inspiration, what I felt. Okay, so this is somewhat greatly linked to the artificial intelligence and machine learning. I believe that's the purpose of this slide. So don't mistake that this is the inspiration that everybody should get it from. Okay, so that's about my inspiration for the AI. So coming to the definition of AI, what is AI? It's very simple. So for example, in my case, I tried to develop a material, okay, that mimic the body structures. Similar to that, in artificial intelligence is nothing but you develop some machines whose intelligence is almost equivalent to the human. That's it. Okay, so you can see that there are three important stages are mentioned here. Okay, so for example, stage one is a narrow intelligence. I think certainly we are all confining ourselves within this range. Okay, that is most of the application that we derive from AI are still within the stage one, I believe. Okay, and then to a great extent, what is AI, artificial general intelligence, is that where the machine intelligence matches with the human intelligence. So that's the second stage that we are striving to achieve, but I think we will achieve this very soon. Okay, and then finally we got the artificial super intelligence. Okay, where this is something like that where the intelligence exceeds a human, ordinary human. So for example, if you want to this sort of intelligence discovers something very new. Okay, for example, a brain of an what do you say, very renowned scientist who is discovering some very new fact, discovering new facts. So it's in that case that can be equated to the super intelligence. So that's about the classification of artificial intelligence. Just remember that it is nothing but we are trying to mimic the human intelligence. So human intelligence means these are the key features. What we do normally, we learn it, we reason it, we solve the problems, we have the touch. Okay, we also understand the language. So if these features have been added to the machine, then it is called an artificial intelligence. So then after this, we are going to jump into another important topic called machine learning. So machine learning, what I would say is that it is a subset of artificial intelligence. So in this is more to the making the decisions or making the predictions. Okay, so that is a major task of machine learning. So this machine learning can be further classified into three categories as shown below. It is can be supervised learning, reinforcement learning, and unsupervised learning. So supervised learning means it's based on the data that we feed it. That is basically we help them. We help to classify them. Okay, so that is a human intervention is there. Unsupervised learning, somewhat the machine learns by itself. Okay, so that is unsupervised learning. And then reinforcement learning, something like that. A machine learns by means of a reward system. Very perfect example is just a game playing. Okay, so this is about a very brief introduction about the machine learning. With this, what we learned is that we try to understand what sort of motivation we have for this AI and ML, and then we just defined what we mean by artificial intelligence, and also we touched briefly about what is machine learning. Now we are going into the next realm of the world, that is medical device. So medical device, what is medical device? Because it's very important, because this topic is highly interdisciplinary. You can't, it is not possible for a single person to work. Okay, so there is a definite need for collaboration. Okay, so this can happen, this sort of work can happen with only with the collaborative effort. Okay, so in order to make you to understand what I done, okay, I want to introduce to this different specialities. Okay, so first we finished with little bit about what is AI and ML. Now I'm moving about the medical device. So what is medical device? Okay, a medical device is an instrument, apparatus, even a chemical reagent. Okay, so what is the main purpose is that it is used for the diagnosis, prevention, monitoring, treatment, or elevation of a disease or symptom. Basically, it affects the structure of the function of the body. So one thing you have to keep in mind, a medical device is not the thing which does its function by means of pharmacological or immunological or metabolic action. Okay, so why I want to highlight this particular last line is that if this is done means, then it is called as a drug. Okay, so that's the difference between the drug and a medical device. So a drug achieves its action by a metabolic or immunological or pharmacological aspect, whereas medical device achieves its function by altering the structure or function. Okay, so that's a key difference between the medical device as well as the drug. So, so we learned about what is a medical device. Okay, we had to be aware about the fact that we can't develop any medical device by today and just implant inside the body very immediately. So this is not possible. So there need to be some regulatory body which controls the what is it? Bringing the devices from the lab to the bedside, that is to the patient side. Okay, so job is taken care by means of various regulatory authorities. I think I mentioned in this case FDA. FDA is nothing but Food and Drug Administration. Every country has its own what do you say, medical device regulatory authorities. For example, in US it is FDA. In Europe we call it as a European Medicine Agency. So what is the purpose of this is that, okay, they have to make sure that the device is safe for the medical use. Okay, because they don't want to risk the patient life. Okay, so safety and efficiency should be proved before the device coming into the market. Okay, so this is taken care by means of FDA. Okay, so in India, I think I'm not sure about that. Might be, I think, Central Drugs Standards Agency. I didn't remember the exact word. In UK, it is MHRA. So that is there are different regulatory authorities on the country. That's the only thing you have to keep in mind. Okay, so what is the basic job for them is that to evaluate the safety and efficiency of the medical device. Okay, so how they do this one is that they classify the devices based upon the risk. Okay, I'm not going very deep into it. Okay, I just want to highlight you what are the different classes of medical device. Okay, so there's class 1, class 2, and class 3. So as the class level progresses, the risk also increases. Okay, so for example, for pacemaker, it's a highly risk devices that can be classified as a class 3. Okay, so and then class 1, it is a very simple example, is surgical instrument, and class 2 is some examples like contact lenses and infusion pumps are given here. So this is why I want to say is that depending upon the risk, the regulatory control will increase. Okay, that's a major thing you have to keep in mind. So we know what is a medical device. So medical device achieves its function by altering the shape or function. Okay, and then this medical device is regulated by the medical device authority. Okay, and how they regulate it based upon the risk it poses to the human life. Okay, so basically it is classified into class 1, class 2, and class 3. Okay, so if I think I have a quick question for you. Is there anyone, do you think that today from the morning, did you use any medical device, do you think? Can you hear me?
No, sir.
You think that you didn't use medical device? Okay. Can I break your confidence? Okay. So just I want to ask you, how many of you brushed today? A smartwatch. Okay. How many of you? Okay, I think you have a smartwatch and all very. It depends upon the definition. Okay, a smartwatch cannot be called as a medical device, but provided if they define as a medical device, then it will be brought into under this restriction. Okay, but I just want to ask you a very quick example. Want to give you a quick example. Okay, so how many of you brushed today? I hope everybody would have done it. Okay, so a toothbrush is a medical device. Okay, very simple medical device. It's a class 1 medical device. Okay, so just want to give the importance. Most of the time we don't realize. Okay, well, the device thing that we are using it is also a medical device. Okay, so a toothbrush is a medical device and it falls under the class 1. So that's about a very brief background about the medical device. Now what I plan to do is that I just want to introduce a little bit what is the use of electrospinning in medical device. Okay, so you can see here. I don't know how many of you learn biology. Okay, in most of the time, okay, in our body, cells are happily living in a extracellular matrix. Okay, so the extracellular matrix means it is a. I think you can see this figure over there. It's somewhat what I would say when I was explaining to students. I would say that it's something like a home to you. Okay, similar to that. For the cells, the home is nothing but extracellular matrix. Okay, so you can see this extracellular matrix structure consists of lot of fibers. Okay, namely collagen, elastin, and laminin. Okay, integrin, and so on. So these are the matrix of fibers where our body cells are attached to it. Okay, please remember something like that. Okay, for example, for me the extracellular matrix is nothing but my home. Okay, so it's, you have to keep understand this one. Okay, so why I want to say is that my home is not the same as your home. Okay, so every cell has its own home. So what does it mean is that the composition of fibers will constantly change with respect to the tissues. Okay, so with that understanding, but one thing is very common is that you could see that the home structure is mostly fibrous in nature. Okay, it's most fibrous in nature. So what I am doing is that I am using a technique called electrospinning. I'm not going deep into it. Okay, just understand that I'm using a technique called electrospinning. In that, I load a polymer solution, okay, in the syringe, and I apply a high voltage. When I apply a high voltage, what happens is that a jet of liquid comes out from this needle tip. Okay, when the surface tension, okay, is overcome by the electrical force that I applied, a jet of liquid erupts. Okay, this jet, what happened is that starts bend at one point of time due to the whipping instability. When it gets unstable, okay, finally it collected as a fiber at the collector. Okay, so this collector, at the collector, the fibers looks like this. You could see that you can just compare the structure of this material as well as the extracellular matrix that I shown in the figure. Okay, so that's the reason. Okay, so what I'm trying to do is that I'm trying to fabricate the devices, okay, medical devices, using the material whose structure is very similar to that of the extracellular matrix. Okay, so you can see here, next slide. So this is the structure of this electrospun material, and then the little bit more clear image of the fibers are shown here. So what I do is that these are the medical devices that I'm trying to develop. Okay, for developing these devices, okay, I am using this material, that is electrospun material. Okay, for example, I'm developing cardiac patches, bone grafts, vascular grafts, and skin grafts. This everything is made up of from the material that has been fabricated via electrospinning. Okay, so what is the advantage of this is that you can see from this slide. uh, I'm also introducing one more topic called blood compatibility. Okay, so what is blood compatibility is that, as I told you that we have been developing some medical devices. So these medical devices is going to come in contact with the body. Okay, so when it comes in contact with the body, your blood proteins, okay, the proteins from your blood start othering on it. After, what happens is that the cells called platelet, okay, start aggregating on it, and then it leads to the activation of various coagulation cascades. So I don't want to go into deep about the various coagulation cascade. I mentioned the name of the cascades over here. Okay, so what is the purpose of this alone, I will explain. So what happens is that when the blood proteins get settled, okay, your platelet get other on it, and platelet get aggregated on it. Slowly it activates the coagulation system. That is, your blood starts coagulate on the surface of your biomaterial. Okay, and then what happens is that it activates the inflammation routes. Okay, when the inflammation is started, okay, finally a lot of macrophages come to the site, and then these macrophages try to engulf this biomaterial, and then finally it results in the rejection of the implant. Okay, so this is the whole life cycle of a medical implant when it placed inside the body. But now we are focusing.
Sir, you are not audible. Sir, can you hear me? You are not audible, sir. Hello. So, are you in link, sir?
Hello.
Yes, sir. You are audible, sir.
Okay, I'm sorry. I think I got disconnected because there is a power cut at home.
Okay, sir. It's okay. Thank you.
I'm just connecting via my phone. 1 minute. Can you able to see my slides now? No.
No, sir.
1 minute. Can you able to see the slides now?
Yes, sir.
Okay.
Yes, sir. Yes, sir.
Okay. Thank you. So I think apologies, okay, because I got disconnected because of the lack of power supply. So I was talking about blood compatibility. So this is the first step. That is when a medical device is placed inside our body, our blood is start interacting with the medical device. So we have to be careful in designing the medical device, or otherwise it might results in the rejection of the implant. Okay, so what happened is the rejection of implant is that because we put the implant to do some specific function. Say for example, we put a what is it, blood glucose monitor. Okay, so we put the needle inside our body. Okay, the purpose of the needle is that to constantly take some blood and then send to the sensor, okay, in order to predict the what is the sugar rate. But unfortunately, if this needle is active experiencing some immune rejection means what happens is that it might results in the coating on the top of the needle, and then you can't able to withdraw the blood constantly, and then you can able to measure the glucose level constantly. So what happens is that it's rejection of implant. We want to avoid this one to happen. Okay, so to avoid this one, what we do is that we are using the electrospun material. That's the purpose of it. I want to explain the reason of doing the blood compatibility. So what we do is that in order to measure the blood compatibility, this slide shows you what are the things we measure it. We measure the platelet adhesion, we do the coagulation properties, hemolytic percentage. What they is basically is a platelet means how many platelets it's adhering on the surface of the material, and also coagulation means how the blood is clotting on the surface of your material, and also hemolytic, what does it mean is that what happens to a red blood cell when it comes in contact with the material. So these sort of things we measure this in the lab. Okay, so you could see that when we want to do this, we need to isolate blood from the human body or otherwise from the animal body. Okay, so this poses a lot of ethical question. Okay, that is, we need to take permission from the ethical bodies, and also that taking blood from human or animal and then wasting it for the research, we can't say as a wasting, but for testing for research, okay, it's not a what is a good strategy, I believe. So what we did is that we want to investigate whether we can skip this step, okay, by using the material properties alone. Okay, that is, we are testing this material using variety of mechanical testing, that is we call it as physico-chemical property testing. We do this in the lab. So we want to skip this actual lab testing, okay, that is using blood, but we want to do the testing using only the physico-chemical properties and then predict the blood compatibility. So whether it is possible or not, we want to examine. Okay, so this is a scheme of the research. I think it is shown in the next slide. Okay, so generally aerospun material. Okay, so we collected some, I think around 50 to 60 research papers. Okay, from those research papers, we collected those physico-chemical properties as well as blood compatibility properties, and then we trained the module. We trained the model. Okay, different models have been employed. I think it is shown in the next slide. And then we want to predict whether the material is blood compatible or not blood compatible. Okay, so this is output of our training. So what happened is that you could see that most of the time, the blood compatibility prediction works well with the physico-chemical properties as well as coagulation time properties. So you can see the most efficient model that could emerge out from this table is that SVM. Nearly, I think around 98 percentage of accuracy was obtained for the SVM, and then similar range. It's not very bad. It's in the for neural network is around 97 percentage, and kernel naive base around 96 percentage. Only thing that has a very low percentage of accuracy is for this RUS boost. Okay, it is around 69 percentage. So after that, what our intention is that we want to skip the coagulation property, that is anything related to the blood. Okay, we used only the physico-chemical properties, that is only the properties that are measured using analytical testing. That is, for example, SEM. The SEM means scanning electron microscope. Okay, contact angle. So this sort of physical testing, we don't use blood. Okay, we use only those properties. Okay, so in this case, what happened is that the accuracy is very similar. You could see that it is around 98 percentage. Okay, which is very similar to the previous table that I shown. Okay, so it doesn't have a significant changes with respect to whether the blood coagulation properties is necessary or not. Okay, so the physical chemical properties alone can able to use and then predict the blood compatibility of the material. And also what we done is that little bit we played around, and then we what we did is some using some data augmentation techniques. We like smart, and then we increased the number of samples, and then we tested it. When we did this one, still the accuracy has been increasing significantly. You could see that previously the accuracy, I'm just showing with only with one module, SVM support vector machine. I don't want to go into the rest of the module, rest of the models. Okay, you could see that it was around 98 percentage without smart techniques. After employing the smart techniques, the accuracy was increased to 99 percentage. Okay, so, and finally, just want to highlight this one model, because this model emerged as a good one for us because it showed a higher accuracy. Uh, you can see here, with the physicochemical and coagulation, that is along with the blood coagulation testing, the model has an accuracy of 98 percentage. When we used without coagulation time also, the model has an accuracy of the 98 percentage, very similar. And then after data augmentation, okay, we got the accuracy increased to 99 percentage. Okay, so that's remarkably highlight that SVM as a good model for predicting the blood compatibility in an accurate manner. And you can see here, these are the features that we used. Okay, and then we could be able to rank those features using this T-squares test. Okay, so you can see a fiber diameter as a most significant relevant compared to the tensile strength, contact angle, roughness, and initial degradation temperature. Might be you may not aware about what are those things, but just remember these are the properties that has been measured using the analytical equipments. It doesn't use any blood itself. Okay. So final summary, just a thing I want to say, what we have done is that we are using this electrospun medical devices. Okay, for this medical devices, we want to predict the blood compatibility. Why you want to predict the blood compatibility? Because you know that FDA, okay, the medical device regulation, want the device to be safe and effective. So we want to test the blood compatibility of the material before going into the market. So we want to test the blood compatibility prediction using this machine learning model. Okay, and then what we found is that SVM emerged as a good analytical or otherwise statistical tool. Okay, in order to predict the blood compatibility of the electrospun material. Okay, so what is a major advantage of this is that we don't need to use blood. So this significantly reduced the time for the testing the blood compatibility, and also avoided use of blood. Okay, which is normally employed strategy for assessing the blood compatibility. That's it. Thank you very much for your patience. Hello. Hello.
Yes, sir, you are audible, sir, but your screen is
Okay.
not shared.
Hey, I'm finished with it. I'm done with my presentation.
Okay, sir, okay.
Okay.
Please let the forum is open for discussion. If you have any clarification, please feel free to type in the chat window or you can unmute and ask.
I hope all is okay. I think no questions so far ahead. Okay. So first of all, finally, I would like to thank everyone. Okay, for being patient, and also thank Adalars and Narsiman for providing this wonderful opportunity. So, well, I think there's one question: how much time we can save with AI to test biocompatibility? Obviously, I think it depends upon various aspects, Rohit. Okay, but there's no straightforward answer for it, because if you see, the blood compatibility testing varies. Okay, depending upon the device that you are testing. If you could able to recall, I mentioned that there are class 1, class 2, class 3. Okay, so every device, okay, has its own risk. Okay, so if you do regular blood compatibility testing, okay, for example, very complicated devices like stent or pacemaker, it's going to be more extensive and more laborious, okay, compared to that of a very simple device, like say for example a wound healing patch. Okay, so it depends upon the device. Okay, I can't say that this is a time save or otherwise this is the amount of money saved, but there is a significant amount of time and money saved if you use ML to predict the blood compatibility. Good question. Smart technique means what, sir?
Target.
I think it is. I don't want to go into very deep into it. I just briefly explain you. It is just a way to augment your data. For example, when I'm collecting a data, okay, I can't able to get what we say many data in order to train my model. Okay, so what this technique does is that it can able to generate more data, okay, and then able to satisfy to develop especially the minority sample. Okay, so that is, for example, if you have a blood compatible material and non blood compatible material means, in most of the time if I'm having lot of blood compatible data, okay, I don't have a non blood compatible data means, so this sampling technique able to produce more data for the non blood compatible, so that our model is not biased or avoid some sort of a problem that arises with respect to the overfitting. Okay, so this sort of thing can be avoided. So in this reason we want to augment the number of data that is weak, especially minority samples. Yeah, you are right, Rohit. Yeah, you are right. It depends upon the amount of data we feed it. Okay, so I don't say that it is almost, because as I said previously, when we want to train this model itself, I think we used only roughly around 50 data sets, I believe. Not 50, sorry, 90 data sets or 99 data sets. I'm not exactly remembering what's the amount of data sets I use, but it's roughly around 100, I believe. Okay, I think previously, I think I wrongly said around 50 to 60, but I could just I could able to recall that it's around something around 100 sets. Okay, so obviously the accuracy, everything will change with respect to the amount of data that we are feeding it. Okay, so it's just a trying, yeah. So it's something like that. Even though we test the blood compatibility using animals, okay, it is not guaranteed that your medical device is going to safe within the human body. Okay, because most of the time we test using animals. Okay, so there is always some sort of exceptions occurs. Okay, same sort of thing applies to the AI. But one thing you can see easily do, think about the benefit of AI is that we are not using any animals, we are not using any human blood. So this is a benefit, I would say. I think certain question goes beyond my expertise. Okay.
Yes,
Uh,
sir.
okay. So thank you very much, guys. Have a nice time again. I think you will have another wonderful presentation coming again. Thank you very much, guys.
Thank you, sir, for your wonderful session. Being specialized in nanomaterial synthesis using electrospinning, you have done a very good lecture. Thank you all. I hope all the participants might have been benefited from your research. Thank you, sir, for your time and patience. Thank you very much.
Yeah, finally, I just want to thank once again the organizers as well as Dr. Adal also. And also, I wish you all a happy new year 2025. Thank you all. Bye.
Thank you, sir. I request all the participants to join in the same link at 7:55. Thank you. All of you please join at 7:55 for the next session by Dr. Surya Prasad.